Assalamu alaikum. I am Dr. Sadia, and today I am going to discuss with you people the miscarriages. What are miscarriages? What are the types of the miscarriages, and how to differentiate between the different types of the miscarriages. So, a miscarriage is defined as a spontaneous loss of pregnancy prior to viability, and that is 23 plus 6 weeks of the gestation. The age of the viability is 23 plus 6 weeks of the gestation. If any people, one asks you for the definition of the miscarriage, you will go for this simple definition, that is spontaneous loss of pregnancy prior to the viability, and that is 23 plus 6 weeks of the gestation. And there are different types of the miscarriages, like threatened miscarriage, inevitable miscarriage, incomplete miscarriage, complete miscarriage, missed miscarriage, and recurrent miscarriages. Now let us discuss about the different types of the miscarriages, how to differentiate between them. First of all, threatened miscarriage. Threatened miscarriage, as it is prominent with its name, that there is a threat to the pregnancy. In the presence of threatened miscarriage, the vaginal bleeding is present, but the cervical os is closed. Cervical os is closed in this case, and the pregnancy is viable. There is a live intrauterine pregnancy, and there, in the presence of inevitable miscarriage, there is vaginal bleeding present, but the cervical os is open. So differentiating point between the two is the cervical os, that it is open in the inevitable miscarriage, but it is closed in the threatened miscarriage. And pregnancy is still present in both cases. In threatened miscarriage and in inevitable miscarriage, there is an alive intrauterine pregnancy. Then go with the incomplete miscarriage. Incomplete miscarriage, complete miscarriage, and missed miscarriage. In the incomplete miscarriage, in the incomplete miscarriage, the vaginal bleeding is present. Patient has started bleeding. Some of the tissues has passed through the cervical os, but some of the tissues are still present inside the uterine cavity. When we go for the ultrasound or clinical examination, we will see the cervical os is open. In incomplete miscarriage, cervical os is open in the incomplete miscarriage, and tissues are still present inside the cavity. And as it is indicated by its name, that it is incomplete. Then what is the complete miscarriage? Patient has gone for the bleeding. The bleeding started, and products of the tissues, products of conception, they are completely expelled from uterine cavity, and there are no RPOC. Cervical os is closed. So the differentiating point between the complete and incomplete miscarriage is the cervical os. Cervical os is closed in the complete miscarriage. It is open in the incomplete miscarriage, and there are no RPOCs in the complete miscarriage, but RPOCs are still present in the incomplete miscarriage. Now, what is missed miscarriage? Missed miscarriage is where patient is asymptomatic. There are no symptoms, no bleeding, no pain, but on ultrasound, fetus is there is no alive intrauterine pregnancy. Fetus is still present inside the cavity, but the cardiac activity is lost. This is known as missed miscarriage. Patient usually does not know about the missed miscarriage, and it is identified on the ultrasound examination. So differentiating point between the missed miscarriage, complete miscarriage, and incomplete miscarriage. In incomplete miscarriage, the tissues are lost. Some of the tissues are lost, some are present. In the complete miscarriage, completely the products of conception has lost, and in the missed miscarriage, the tissues are still present inside the cavity. What is the definition of the recurrent miscarriage? When 3 or more than 3 consecutive pregnancy losses is known as recurrent miscarriage. This is the diagrammatic presentation of the incomplete and complete miscarriage. In the incomplete miscarriage, cervical os is open. Cervical os is open. The tissues are still present inside the cavity, and the vaginal bleeding is still present. But in the complete miscarriage, cavity is empty, os is closed, and products have been completely expelled from the uterine cavity. So the differentiating point is the cervical os. Cervical os is closed in the complete, open in the incomplete miscarriage. Cavity is empty in the complete, but there are products in the incomplete miscarriage. Similarly, there are threatened miscarriage and inevitable miscarriage. In the threatened miscarriage, in both threatened and inevitable miscarriage, there is an alive intrauterine pregnancy. Os is closed in the threatened miscarriage, but it is open in the inevitable miscarriage. There is minimal bleeding in the threatened miscarriage, but there is bleeding present in the inevitable miscarriage, and os is open, and this is about to miscarry the inevitable miscarriage. This was about the differentiating point between the different types of the miscarriages. I hope you will understand miscarriages, and you will be able to answer different types of the miscarriages and how to differentiate between them.